Hi, everybody. Welcome to our community update for the Squamish Nation community today. We are live streaming to Facebook, and we're going to be doing an update for the next hour on the next clinics that will be happening in the community, and some wonderful news to share, some exciting updates, but we also are going to do a Q&A to answer questions that community members might have like we did last time, which is going to be great. We're going to give it a few minutes as people sort of get notified that there is a live happening right now. We have about 28 people watching currently. Last time we had about 80. And then people shared it after and helped spread the news around the community. And this is just a way that we want to get information out, answer questions, and communicate to the community. So if you see me looking over here, it's because I have two monitors and I'm sort of monitoring the questions and comments that come in. But we'll get started in like 60 seconds. We'll wait for a few more folks to join us. But I hope everybody's doing well. The weather is getting nicer, which is great. And yeah. How are you doing, Satakan?
Doing very well, Cofilam, and as we can appreciate, the kids are on spring break right now, so extra, parental duties for all of us in the community, ensuring that the kids keep busy at home, and we ensure that we're social distancing and but also enjoying the wonderful weather. So hopefully everyone else is as well. And yesterday was such a great day, and looking forward to the summer and all of that. So, and also looking forward to the information that we're going to provide today as well. Thank you.
Awesome. Well, we'll get started. We also have Vanessa, who's here with us, who Chris will be introducing in a moment. Thank you, Vanessa, for joining us. So a couple of quick updates for everybody. First and foremost, we want to share and celebrate a wonderful success of our last clinics that we had a week and so ago. We had more than 700 people in the community vaccinated in our first round of clinics. That was in Squamish Valley and North Van. The vaccinations are critical to keeping everyone safe through community immunity, and are critical and required in order for us to get back to normal, the lives that we had before the pandemic. The next round of clinics for the Squamish Nation on reserve vaccinations are going to be happening on the week of March 29th, which is next week. And we're really excited to share, if you haven't heard yet, that we are doing an all community member and staff 18 years of age and older can now be registered to be vaccinated. Really important to emphasize for the community that we are doing what is often referred to as a whole of community approach. This includes all people who live in our community, whether they're a nation member or not, whole community, as well as all of our Squamish Nation staff. Want to emphasize that when leadership was advocating for our communities, go back a month, and we were, being told by the health authorities that we might get it in 2 weeks, then 2 weeks would go by, and then they'd say maybe in 2 weeks, and 2 weeks would go by. And that was really largely due to the changes in the supply of vaccine coming into the country. But as we knew that there was more going to be coming soon, we were advocating with our relatives from Salewat and Homatspoyam, and the leadership from all three communities were working together to advocate to the Minister of Health, the board, and the CEO for Vancouver Coastal Health, as well as the staff from First Nations Health Authority. And what we've really emphasized is, and it was recommended by the health professionals, a whole of community approach. So that's everybody that lives in the Squamish Nation reserves. We have community members who are not nation members, but they are community members. We have Indigenous people from elsewhere that live in the community as well. We wanted everybody to be safe because our communities are considered vulnerable. We have a higher degree of household sizes than off reserve that you'll typically find. And that it's for the protection of our community. It is best to have the whole of community approach to protect everybody that is living in the community and utilizing services in the community. Leadership also advocated for our staff to get vaccinated. And this was a critical piece. And I want all of our community to understand that we asked for this because our staff are providing a lot of critical services, programs and services for our community, we wanted to protect our staff. We want to support getting back to normal and providing services for the community. And so leadership asked that our staff be included as frontline workers as well. So all of our employees that want it will be available to register as well as of today. So for the community to understand, this is something that leadership really advocated for and asked for in order to protect our community. We also want the community to know that leadership was very proactive and in asking for vaccines for not just the on-reserve population, but our off-reserve population that lives nearby the reserves. So within a certain distance. And this is because we recognize that a lot of our members who live near the reserves, whether it's 5 minutes down the road or even a block down the street, because a lot of our people are still coming onto the reserve to help their family, support their loved ones, or they're accessing services in the community. And so we felt it was important to include everybody. For our members who live further away, that there's going to be some more information shared on that in a little bit. But we really want to emphasize and remind everyone that frontline staff are doing their best, that we want to thank all of our staff and also thank our people for your patience and understanding on this. It's taken a lot of work to prepare for this next clinic. There's going to be almost 2,000 people getting vaccinated over the 3 days. And that's a lot of logistics to sort out, which has taken time. And we want to run a very efficient, very safe, very well organized clinic for our people. And I really want to thank all of the staff who have been working really hard on that, and really want to thank our people for your patience as we work through this. Everybody's going to get there at some point. We're very fortunate, you know, our community, a lot of our people will be getting the vaccine much in advance of the rest of the population. And that's really important. It's really integral because, as we know, and this is what some of people in the outside world need to understand, is our people are very vulnerable. We have underlying health conditions, social determinants of health that put us at higher risk, largely because of colonization and the impacts of policies that have led to these current underlying health conditions. We are much more vulnerable because of the disease, and we want to protect our people, prevent as much illness, sickness, or death from COVID as much as possible. And so we're really grateful that we're getting access early to help protect our people. I'm going to hand it over to Setauket, Councillor and Spokesperson Chris Lewis, for some further updates.
Thank you, Colseelum, and just want to thank each and every one of you for tuning in today, and really, again, echo Colseelum's comments around thanking our frontline staff, our workers, our leaders for the advocacy, and all of you for continuing to do your part to ensure that our communities stay safe and that our families and those most vulnerable continue to stay safe as well. Just to dovetail in terms of what Colseelum mentioned, is I really kind of want to talk about, if you are a nation member that lives, say, on Vancouver Island or in the interior, say the Okanagan, what should you do? How do these clinics work for you or don't? And if you're living in Vancouver Island or say in the interior, we're encouraging all of our members that live in those areas to book appointments through their local health authorities. So right now that means the local health authorities in those areas are taking bookings for our people, Indigenous people, 65 and older. But in April, they're going to drop that down to 18 plus. So watch your local health authorities if you're living in the interior, if you're living on Vancouver Island, to ensure that you're registering for an upcoming clinic in your geographical region when that comes. Also, even though we're in the home stretch, even though we can feel that the tide is changing as it pertains to this global pandemic, even with the vaccine coming and everybody kind of hopefully getting vaccinated as a community whole approach, the public orders that are in place must be followed. We must keep our community safe. We know that there's active COVID cases in our community right now. and the community and everybody involved is doing their best to ensure that those impacted are continuing to self-isolate, that the virus stays contained. And I really want to thank each and every one of you for doing that. But this really means that we need to reinforce all of those rules around social distancing, ensuring that there's no indoor gatherings or other types of gatherings of any kind. And as we heard from Dr. Bonnie Henry last week, we can gather outside in parks, beaches, in backyards with the same group of 10 people. So if you meet with a group of family members this weekend, with Easter coming up, make sure that that bubble of 10 stays the same bubble of 10. It doesn't mean that we can, the following weekend, gather with a different 10 folks outside and do all of that. And we must ensure, if we're gathering outside in any group outside of your immediate household, that you're maintaining all the social rules, like social distancing. If you can't maintain that, that you're wearing a mask, that you're continuing to do your part. But we know that it's critical to ensure that we're having social interaction. Please reach out to those, especially our elders and our most vulnerable that might be living on their own and just need some interaction as we come out of the winter months here. So just continuing to kind of encourage our members. I know we can feel like with the vaccines here, we feel like we're in the home stretch. We're kind of in that canoe race together. Can see the finish line. We still got to dig down deep and continue to kind of adhere to all of the rules that we've been stating all along with this. Without further ado, I really want to introduce Vanessa and thank Vanessa Dent for joining us today. She's one of our nurses and she's also our home and community care manager. She's here to help us walk through the clinics and what community members should expect to see when they kind of come to Chief Joe Mathias Center or Totem Hall, what they should expect to hear or get back when they're registering for clinics, and any other kind of questions that you have. Feel free to ask any question that you may have of Vanessa or Colselam and I, and we're here to kind of have a great Q&A with all of you today. Thank you very much. I will pass it over to Vanessa. Thank you.
Hello, everybody. I'm Vanessa. I'm the nurse with the Squamish Nation Home and Community Care Program. So some of you might recognize my face from being in your house to go ahead and help set up home care services. I'm also new to the manager position with our home and community care program, as well as taking part in the vaccination clinics. And it's just such an honor to work with the Squamish Nation, so thank you. In regards to the clinics that are coming up next week, we have the 29th, 30th, and 31st. The 29th and 30th are going to be here on the North Shore, and the 30th clinic will be in Squamish Valley. The Chief Joe Mathias Center is where the clinic will be for the North Shore community, and it's anybody that is able to call that is 18 and older. One of the very first questions I know we will get will be, what vaccination are we receiving? And unfortunately, we do not know that yet. We may not even find out until the morning of the vaccination clinic exactly which vaccination we should be receiving. It's highly likely that it will be Pfizer or Moderna, because we have not seen any of the other two out in community quite yet, because those were just recently approved. But as Dr. Henry had said, basically, you should be accepting of whatever vaccination becomes available, just because they are, kind of trickling out. But luckily, since Pfizer's back up and running, we are receiving much more frequent shipments of those. So that kind of semi-answers that first area. In regards to how to schedule yourself an appointment, if you are in the Squamish Valley, you'll be going to the Totem Hall, which is on the 30th. In that particular one, you can email svcovidinfo@squamish.net. Or you can also call the totem hall number, which is 604-849-0191. And that you can talk to somebody on the phone. In regards to the Chief Joe Mathias Center here on the North Shore for the 29th and 30th, that one is you email covidinfo@squamish.net, or you can call 604-318-0481 or 604-982-0332. We have lots of people accepting calls at that location. And again, it's anybody that's 18 or older. We know that people that are younger, because there are vaccinations that are approved for 16 and under. Currently, Pfizer and Moderna are not either of those vaccinations. So people that are younger than 18 are going to, they have to wait a little bit longer, and most likely they will probably fall under the provincial health when they receive their vaccinations. So we can update that at a later date. We just don't have that information for now. When you come, I want you to come prepared with the information that you need to make your appointment. We want the names and age of basically all the people that are 18 within the household that are wanting to receive their vaccination. You want to have a phone number, an address, and you also want to make sure that everybody has their personal care card number, so that way we can go ahead and keep track. So when you're due for your next vaccination, we can reach out and let you know when that is going to happen. This particular clinic coming up next week is still considered a first vaccination clinic, which means you're still going to be receiving just number one, even though we are going to have further vaccination clinics further out, but this is still considered round one. The next vaccination should be happening around 4 months from now. I know that initially when the vaccines came out, they had said it was around 35 days we were going to be receiving the second vaccination, but BC has changed that to be 4 months out, because there have been studies that have been done that have said the efficiency of the vaccination is still at 90% effectiveness 4 months out. So we're trying to get as many people vaccinated with the first vaccination. So that's the reason why that got extended. And then the reason of this second vaccination, so the first one brings you up to about 90% safety. And then the second vaccination kind of brings you to that additional 4 to 5%, and then longevity of the vaccinations. That's both for Moderna and Pfizer. And there still need to be further studies to find out whether we need to have, more booster shots in the future, because this is such a new vaccination process. But for right now, it is known that there are just 2 vaccinations per cycle. In regards to make sure when you come to the clinic that you come prepared with wearing either a nice short sleeve t-shirt, obviously a jacket, dress appropriately for weather, but you do want to make sure that your arm is easily accessible. Just a little piece of nursing advice for you. When you choose which arm you want to get your vaccination in, it's going to go right in your deltoid muscle, right up here at the top. You're going to want to choose the arm, if you're a side sleeper, that you're going to sleep the least on, the side that you don't lay on very much, because your arm is going to be a little more tender. And I always recommend to people, I prefer to get it in my dominant arm because I like to move it around a lot more. It seems to be a lot less sore. My biggest complaint about the vaccination when I received it was that my arm was more sore than I had anticipated, but it only lasted 1 day because I was really conscious about continuing to move that around. You absolutely will be able to go ahead and go to work or do whatever it is that you need to do after you receive your vaccination. There is the potential that you could have a few side effects in the fact that there flu-like symptoms, but most people seem to be able to handle them. I think it happens a little bit more to our elderly population where they experience that mild fever or the mild achiness, tired, just feeling a little unwell. And it kind of dissipates in 24 to 48 hours after you receive your vaccination. Obviously, if it continues or those symptoms worsen, we want to reach out to our doctors and also contact the 811 nurses line, and they can help guide in regards to that. But the biggest complaint was more just a sore arm. And of course, I just lost my train of thought, but it's been pretty good. I know that I have heard of studies that the second vaccination is usually when people seem to have that little bit higher chance of feeling a little unwell. So we don't have to worry about that this first time so much. It's more 4 months down the road where you may feel a little more unwell. So definitely come prepared. Now, when you come into the clinic, you have to be by yourself. You're not allowed to have somebody accompany you for that particular vaccination, just because we're trying to minimize the amount of people in the room as possible. When you check in, they will check your little care card and your name and date of birth and everything. If you don't have your care card with you, just have a piece of ID and make sure you have your care card number. That's the number that starts with a 9. It's usually on the back of people's driver's license or your BC service or care card. They will do a temperature check, and they will do just kind of a basic COVID screening. So that's basically, we're all pretty used to that by now, the COVID screening. Have you traveled? Do you have any signs or symptoms of COVID? Are you feeling unwell? All that sort of stuff. And then you'll be shuffled along to see the nurse. If you have somebody that's going to accompany you for any reason, they do need to wait outside. If we do have people that are having any mobility issues, you just let us know and we can have one of the volunteers inside help that person along. There is a 15-minute waiting period after you receive your vaccination. The nurse, of course, will give you all of the background information again about the vaccine that you are receiving. The observation period is 15 minutes after, and that's just to make sure that nobody's having an allergic reaction right initially after they receive that. And it's just it's a standard vaccine safety protocol for any vaccine that we receive. That happens even when you receive your flu vaccination. The likelihood of having a really bad allergic reaction is very, very minimal, which is very awesome. And just to note, from another nursing standpoint, it is possible to have an allergic reaction, within 24 to 48 hours or even a little bit longer. Obviously, if it feels life-threatening for any reason, you need to call 911, but it's been very minimally reported that these things have occurred. So the vaccine they have deemed with studies so far has been very safe. And then after that 15 minutes, you are free to go home. And like I said, continue to move your arm around. You can use a hot or cold pack according to whatever is comfortable, but you don't want to rub the side a whole bunch. It's basically just using your arm, and that'll help the soreness go away. I think those are kind of the main points that I wanted to cover in regards to the clinic process. Now, one other thing that I want to cover is that if you have tested positive for COVID, that's perfectly okay that you have in the past. You should still be getting the vaccination, with the note being that if you have had COVID in the last 3 months, we ask you to hold off in getting your vaccination for 1 to 3 months after you've tested negative. And the reason for that is, again, the province in Canada is trying to get as many vaccinations in people as possible. So it's a weird way of looking at it, but it's kind of like spreading the love a little bit, because your body has created somewhat of an immune defense since you just recently had COVID. So the likelihood of you getting it again immediately is very, very low. So after that kind of 3 months have lapsed, then absolutely get yourself vaccinated. So that's one thing that we wanted to cover. And yeah, I think I've gotten most of it for now. And I think I'll wait the rest for questions.
Yes, thank you, Vanessa. We have a number of questions that have come in from the community. And we'll go through them as quickly as we can. I think we'll try and, some of them are you sort of answered, but we'll go through them again just so that people can hear the answer. And I think some of them are quick answers and some of them might be longer. So one question you did answer before, but if you can quickly answer it again. Do we know what vaccine we're getting for next week? Yes, sir.
Unfortunately, we do not know the vaccine that we're getting next week. We may find out a day or two beforehand. If we do happen to find out beforehand, I can absolutely ask you guys to go ahead and update that information on Facebook, but we do not know. And that seems to be the information that we're all going to get as well until just a day before, or if not the day of.
Great, thanks. I'll take the next question. Will the vaccine be available for off-reserve members?
Yes, the vaccination is available for off-reserve members. It's basically opened up to First Nations peoples, is my understanding. And so FNHA is supplying these vaccinations for us. And if for any reason you are not able to make it to this particular clinic, you are able to contact Vancouver Coastal Health, and they have their, if you essentially just Google Vancouver Coastal Health COVID-19 vaccination, they do have the phone number available where you can book through them. And here on the North Shore, they are doing vaccinations at, it looks like Sunset Community Care Center, the Vancouver Community College Test Collection Site, and West End Community Center, the ICBC Test Collection Site, and the West Vancouver Community Center. As to what dates those are, I'm going to refer you to looking that up at the Vancouver Coastal Health website, though.
And if they don't live in Vancouver Coastal Health, check the health authority that they live in.
Absolutely.
Next question is, when will people be contacted if they have registered for one of the clinics? Vanessa, are you there? I think it might have closed. Yeah. I can partially answer the question, which is I registered on Friday and I got contacted on Saturday. I registered by email. So I know that they have hired a number of callers who are calling in and answering calls and emails and replying back to people. So it should be soon. It just depends on when they're able to get back to you, but sometime soon. Our health nurse, unfortunately, is having technical issues, so hopefully she can join us again. I don't know if you and I, Chris, can answer most of these questions because they're very health-oriented. Vanessa,
she's back. Just want to echo. Just want to echo your answer on how long the registration process took. I registered myself as well through email, and within 24 hours, I got an email back around the clinic and when I could come down on the 29th. So it's very quick. So encouraging everybody 18 and under to register.
Vanessa, could you turn your phone?
Yeah, let me try.
Yeah, we'll go with that.
Does that work?
Yeah.
Okay.
The question that you missed, me and Chris did our best to answer it, was when will people be contacted if they have registered?
Yeah, we have our teams on it, so they really are very quick at getting back to you. It'll either be same day or next day, essentially.
Great. So the next question is, how is our vaccine different from other vaccines?
Okay, let's see if I can kind of figure this out. I'm not sure if this particular person means how is this vaccine different in regards to like other vaccines that everybody else receives. This is the Pfizer and Moderna vaccines, and all of these vaccines are the same ones that are all throughout Canada, the United States, everything like that. So everybody is receiving the same vaccinations. So they don't differ for the First Nations populations at all whatsoever.
Sorry, Vanessa, I think I wrote it incorrectly a little bit. I think it's okay. If we were to get Pfizer, which is what we had last time, how is Pfizer different from the other vaccines? Or how are the other vaccines different from Pfizer, maybe?
Okay. Yeah, so Pfizer and Moderna are both mRNA vaccinations. And to put it like very, very basic, so mRNA is basically a little piece of information that your body uses to tell, to send messages on how to make cells and all that other stuff, information from your DNA. So basically I didn't explain that very well. I can tell you that from a nursing standpoint, but, so basically what's in the Moderna and Pfizer, it's a little piece of mRNA in there that it gives your body essentially a blueprint on how to recognize the COVID virus if you were to contract it. So then that way it can take that blueprint and be like, oh, hey, I know what this is. And now I can create, a protection against it. So if you were to contract it. So that's putting it very simply. Now, in regards to the vector ones that are coming up, which I think we could focus more of that information on probably in future Facebook Lives, just because the likelihood of us receiving that right now is not very high. But those particular ones, they actually take another virus, but it is a completely harmless virus. And it's got a little piece of it's basically got the same little spikes as the COVID virus. So it's kind of like an imitator, but it cannot give you COVID at all whatsoever. And your body is able to recognize those spikes and then understand that if you did go ahead and contract COVID virus, then it would recognize that and be able to put up an immune response to that. So that's the basic of that one.
Great. Next question is, there's been a lot of media attention focusing on the Astrazeneca vaccine. And so we had a community member that wants to know, is the Astrazeneca vaccine safe?
I have to be honest that I have personally not found out a lot of information about the AstraZeneca vaccine yet myself. And that's because it has come out so new. But I do have to tell you that each one of these vaccines are vetted like a lot. There's a lot of studies that go in. There's a huge process that goes into making each and every one of these. So, and Canada and the other countries would not approve them if they were not safe. And there will be continuous studies that continue to follow them and the safety of these vaccinations. So, and luckily, like I said, again, the likelihood of us getting the AstraZeneca this next particular time is not high. So it does give you more time to be able to find out about it.
And yeah, and I just did a quick search, and Health Canada said today Canadians should not be concerned about the safety of the AstraZeneca vaccine. The director of medical science at Health Canada said that the issues flagged by the US Federal Health Agency relate to the product's published efficacy rate, not whether it's safe to use. So Canadian health officials have carefully studied the vaccine, and they do say it is safe to use and that there aren't issues around its safety. So, but we'll move on to the next question.
Great, thanks, Kalselam, and thank you, Vanessa, for the excellent answers here. Next question from our members are those that are receiving the vaccine being informed that they still may be able to pass the virus on to others as asymptomatic carriers?
So I can tell you from my own personal practice, what I am doing with the people that I'm vaccinating is that I am letting them know as part of my education that we still have to continue to wear our PPE, so our masks, and practice our hand sanitizing and all of that. That's probably going to last at least another year, which, you know, it's kind of hard to swallow, but there haven't been complete studies that have been able to say that we're not still carriers. So they're working on that. So it is very important that you could be somebody that's vaccinated, but you could still potentially be a carrier. That is, and when they swab your nose and go way up there to like feel your brain practically, it's painful. But that's where the virus kind of hangs out in. And you could be one of those people that have it and have no idea. Or if you're vaccinated, you could just be carrying it around up there and passing it along and have no idea, but it's not affecting you. So they don't know for sure. So that is one of the things we do still have to be very diligent about.
Thank you.
Another question from the community member, are there any side effects to the vaccine?
So like I said before, kind of the general side effects that you may be feeling initially after you have received your vaccination. You could be feeling, you might have a little soreness at your vaccination site. I do apologize, I think it's the Moderna vaccination. One side effect that has been noted is that about 8 days after you receive your vaccination, people have a tendency to get this little red circular rash at their vaccination site. And then it does seem to dissipate, or it is going away. That's one from Moderna. And then the kind of the typical flu-like symptoms post-vaccination, whether that be mild fever, body aches, chills, just kind of feeling unwell or feeling extra tired. Those seem to be kind of the regular side effects which occur with many vaccinations.
Thank you, Vanessa. Next question is, will the nation be doing a second vaccine clinics for those people that need the second doses within a few months?
Yes, we will be doing those. I can't tell you exactly what the date of those are yet. Like I said before, at this time, we know that they're supposed to be 4 months out. However, if we do manage to get shipments that are sooner for the second vaccinations, then we will vaccinate people with their second dose more quickly. So I don't know exactly how that is going to plan out exactly.
Thank you.
Thank you. Our next question is, do we know when those under 18 and under will be, or those under 18 will be able to access the vaccine?
That's a little bit of a question that's hard to answer, given that it depends on which vaccination we receive, because not all of the vaccinations have been approved for people that are younger than 18 years of age. I think it's Moderna. Don't quote me on that. I can't remember. One of the mRNA vaccinations has been approved for people 16 and up. But since we do not know which vaccination that we are receiving, we are only taking 18 and older at this time. So that can be, when we find out more information in the future, we'll be able to set up a clinic for that, or they go through their local provincial health authority. And I did think of one more thing before we go on to the next question about one thing that I wanted to show people. When you're at your clinic, you're going to receive two things. So we've got this little card here. It's the immunization card, and everyone will be handed one. And so at the first vaccination, the nurse will fill out one side of the card here. And then what I suggest you do is that you go ahead and keep this card in your wallet. It's your verification that you've received your vaccination. And then when you come to your second vaccination, we'll fill out the second side here. And then you can use this as your verification that, hey, when we're allowed to travel again, I have received my vaccination. So this is your proof. And then if for any reason why you lose the card, we're also, the nurses and the front staff fill out what's called this one right form. And basically this one was mine. So basically it's, we keep the white copy, and then we're going to give you the carbon copy, the yellow sheet. Keep that yellow sheet in a safe spot at home. So if for any reason you lose your travel card, that you still can provide whoever it is that you need to update that you have been vaccinated.
Yeah, that's excellent information, Vanessa. And I think the next question is, how long does the vaccination last?
That we don't really necessarily know that information yet. The studies have shown that this first vaccination gets you up to 90%, and that's with Pfizer and Moderna. I have to learn more about the other two, the Astrazeneca and the Covet Shield, so we can update at further education sessions with that. But with Pfizer and Moderna, the first one gets you to 90% efficiency or efficacy rate. And then the second one bumps you up that additional 4 to 5% and gives the longevity. Now that longevity is the question mark there that we don't really know the answer to yet. And so we have to wait as a general population to find out further information from the Pfizer and Moderna companies, because they are always going to continue to doing studies how long these last for.
Great, thank you very much.
You answered two questions at once. Thank you. Can people with compromised immune systems get the vaccine? Is there anything they should be aware of before getting the vaccine?
Absolutely. People with compromised immune systems should be receiving the vaccination. If you are absolutely, like, I'm just really not sure, you need to have that conversation with your doctor and really get that clarified with them. Otherwise, it is recommended that people who have compromised immune systems receive the vaccination. There are just a very, very small number of people who are not supposed to be vaccinated, and pretty much those people already know they're not supposed to because their doctor has talked to them about it. So if you have any questions, I definitely suggest talking to your doctor, and you can also call the 811 nurses line. But immunocompromised people, as we know, they're at higher risk of contracting COVID and it affecting them more. So it's absolutely recommended that we get those people vaccinated. And that community immunity that we hear, those terms, that's a really good thing to think about. If you're one of those people that don't have a compromised immune system and you're kind of, hemming and hawing, should I do this? Should I not do this? Because there are the people that are in the community that can't get vaccinated. And so you are actually protecting them by getting vaccinated yourself.
Great, thanks, Vanessa. And that's one of the reasons I get the flu shot every year, is because my kids can't get it. So I don't want to give them the flu. And that was just an excellent linkage as well. The next question, I think, is probably for all of us. Can members who live away from the community receive financial assistance for travel costs to travel home to get the vaccine?
I personally can't answer this one, so I'm going to turn that over to you guys if you have further information.
I think on this one, we'll have to get back to members on this. I know that there was this question had come up before, and I think we were waiting for an answer on this. As of right now, there wasn't really plans or budget available for that particular type of cost. But I know that staff were asked that question, and we were waiting for a response to that as well. So I would say in this one, we'll have to get back to the community on, and hopefully through our, recommend joining our email list if you aren't already, because we have about 900 members on our email list to receive information when it becomes available, and that'd be the quickest way to get the info. Or yeah, we'll try to update as soon as we can as we find out more on that one. Great.
Okay. I'm going to bring up one little subject because I know it'll probably come up. As we know, there are people in the community that are homebound. And one thing that we really want to stress is you are much more likely to get your vaccination much sooner and more efficiently if you are able to come into the clinics to receive your vaccination. And the reason being is that because these vaccinations are so fragile, the molecules themselves are so fragile, we are extremely limited in the amount of time and the number of people that we are able to vaccinate when we receive at home, when we receive shipments of these vaccinations. So unless you are completely immobile and are not able to get out of your house at all for any reason, that be grocery shopping, doctor's appointments, or whatever, you just do not leave the house, then you are able to come into the clinic to receive your vaccination, or we require that you do have a note from your physician. And again, that's really to stress that we just don't have the resources, and because of the nature of the vaccinations themselves, that it makes it really difficult to do homebound clients. So we have to keep that list small.
Good info, thank you. Next question is this vaccine going to be like the flu shot where we have to get it every year? We sort of answered this already, but maybe the answer.
Unfortunately, I'm not really able to answer that question exactly because there need to be further studies done. So that will have to be something that we have to direct our attention to Dr. Bonnie Henry about. And so at this time, we just do not know.
Great, thanks. I'm going to combine question 15 and 16 just because they're related. If you are breastfeeding, can you get the vaccine? And the second question is, if you have allergies to shellfish, can you also get the vaccine?
Okay, absolutely. So in regards to the breastfeeding one, I was talking to our public health nurse today. Her name's Karen. I'm sure many of the community members are familiar with Karen. She's wonderful. So she has told me that they have just recently come out with some very, very, very new studies that are showing when a breastfeeding mother receives the vaccination, that some of those antibodies are able to pass through the breast milk. And so that's actually probably adding extra protection to your little one, which is fantastic. So it is absolutely advised for you to go ahead and receive the vaccination. Again, talk to your doctor. That's, the safest thing to do. But it is recommended that breastfeeding moms go ahead and get vaccinated. And it is also recommended that pregnant mothers go ahead and get vaccinated, again, because there is the opportunity that those antibodies are being passed along to the baby that's growing. And so they may have some protection once they are born, because they have determined at this point in time that the benefits of the vaccination outweigh any of the risks that have been said. Yes. And in regards to the allergies, okay, back to allergies. So this one is kind of a little bit funny because like if you have an allergy to shellfish or anything like that, There's nothing in these particular vaccinations, both the Moderna and the Pfizer. I have to learn more information on the other two. There's nothing that has caused the allergic reactions. So if you have an allergy to iodine or shellfish, you're still okay to receive this one. The only contraindications that they say are as if you had an allergic reaction to the vaccination in the past, which obviously this is the first one of the COVID vaccination, so you wouldn't really know that. But a good indicator is if you've ever had a bad allergic reaction to a previous vaccination of any kind, then that's something that you want to go ahead and talk to the nurse about when you're going to go get vaccinated. And they can go through that list with you a little bit more carefully. But for the most part, there's been a very low incidence of allergic reactions to these vaccinations.
Great, thank you. I'll pass number 17 over to Carl Seelam.
We have 4 more questions and then we'll wrap up for today. What is the minimum amount of time between the first and second?
Well, right now that kind of depends. Since the province, Dr. Bonnie Henry, I don't know how to totally answer this one because they have extended that amount of time. So you can't just run in after, 35 days and they're going to give it to you. Yeah, I don't really know how to best answer that one. But it's recommended that there's no less than, I think, 35 days was my understanding between the vaccinations. But since that's been extended, that's not really an issue right now.
We'll move on to question 18. Do you have any recommendations for antibody testing?
I have to be honest, I do not. And one of the things that I have heard about was with the antibody testing, that can be a little bit difficult. So if you had a recent infection of COVID-19 and were to go and get an antibody test, the likelihood that you'd show up that you'd have those antibodies in your system is probably there, that you would be able to see that you've had a reaction and can show that you do have antibodies. But there have been reports that have come out that have said that kind of seems to wane and taper off. How big that time span is, I really don't know. That those antibody tests haven't really been all that effective. I want to say maybe it was about after 8 weeks of having a positive COVID and recovering from that illness, then it made it more difficult to sense those antibodies with those antibody tests. So that's not a great way to be able to go find out whether you have immunity or not. It's more important really to get vaccinated. And one thing that I also really do want to stress, that I apologize, I should have said in the very beginning, in regards to these vaccinations, it is still possible once you receive your vaccinations, both 1 and 2, it is still possible to get COVID. Is the chance going to be much less? Absolutely, it's going to be much less. And you are most likely going to have a very, very mild symptom, if nothing at all, of COVID, if you were to go ahead and contract it. And it's just, and you have to think about it.
Oh, I might have froze again, unfortunately. I know.
And so there's so many strains, and as we know, that's okay. And as we know, there's more than one type of COVID out there. So it's important to know that it is still possible to catch COVID, but it's really important to get vaccinated, because the likelihood if you do get it after you've been vaccinated, you're going to have a fairly easy breezy, illness compared to what you would have had if you had not been vaccinated.
Next question is, can you go to work the next day after taking vaccine?
Yes, you can go to work the next day. again, you may have some slight feelings where you're just not feeling so great, kind of, you know, the mild flu-like symptoms and such. And as long as you feel that those aren't too overpowering for you, then you can absolutely go to work the next day.
Great. Thanks, Vanessa. And this is the last question of the night, and really want to thank everybody for typing in their questions. Will the second dose of the vaccine be the same as the first? And I know that was a question we had last time around as well.
So in regards to the Pfizer and Moderna, so if you received a Pfizer vaccination the first time, then you're going to receive a Pfizer vaccination the second time. And same with Moderna. If you received Moderna first, you'll receive Moderna second. Now, in regards to these other two that are new, the Astrazeneca and the Covet Shield, those are both also a 2 vaccination course for the cycle. But it is said that right now, if you receive Astrazeneca as your first one, you can receive Covet Shield as your second, or vice versa with those. I would say let's wait till a further education session to delve further into that, since they're still so new and we have not offered those yet. But if you receive Pfizer the first time around this time, you're going to get that one again the second time. They are not interchangeable.
Thank you.
That wraps us up for most of the questions. There's just one question that I was going to answer, just to reiterate for the community. So the nation is taking a whole of community approach. And so Vanessa, if I understand that correctly, any of our residents who live on the reserves can register for the vaccine. Is that correct?
Correct.
Yeah. So whether you're a nation member or not, if you live on a Squamish Nation reserve, if you're a resident in the reserve, the whole household, 18 and older, can register for the vaccine. For the members who live off reserve nearby, it's just for the members. But the rest of the household will have to wait until the rest of the clinics open up and the vaccine becomes available. This is based off of the amount of vaccines that we had asked for. So they're supplying a number for us that was based off of the numbers that we provided, which was a mixture of our on-reserve population, which included members and non-members, our staff, as well as an estimate for a certain amount of our members who live within a certain vicinity of the Squamish Nation Reserve. The other thing, Vanessa, too, if you can just elaborate too, is I've seen that generally, not just the nation, but off reserve with the health authorities, that they're also working through the age groups down. And so that there's the ability for people, say like 55 and older and soon 50 and older and things like that, to also register for the vaccine if they miss this clinic as well.
Yes. Yes. And if you're part of Vancouver Coastal Health or whichever health authority you are in, you can go to those websites. And if you just essentially type in COVID vaccination, it should bring you. When I have the Vancouver Coastal Health one in front of me, and it does have a breakdown as to what the age groups are and everything, and how they're going to be doing that from month to month.
Great. Well, thank you so much, Vanessa, for taking all the questions and doing all this wonderful work for our community. We really appreciate it.
It was an absolute pleasure, and I'd love to come back.
Great. Thank you, Satoktan, as well, for joining us. And thank you to all of our members who stayed with us or listened, or if you're watching this later on and somebody's shared it and you want to watch, lots of great information here and lots of questions answered. If you have any more questions, send them in to communications@squamish.net. They'll pass it along to the appropriate staff who can follow up with you as well. So I'm looking forward. I'm getting vaccinated on Monday as my when they call me back for. So I'm excited about that. I'm looking forward to it. But just to emphasize for people as well, that when you get the vaccine, and they will tell you this when you get it, my understanding, is that there is still time before you build up the protection. And so it doesn't take right away. So don't get the vaccine shot and then go run into a gathering of people. You're still at risk. So it's really important to follow the health orders even after you get the shot, and even weeks after, as you start to build up the immunity.
Thank you. You're doing my nursing job for me. I should have said that. So yes, I do. I'll add just a little more detail to it. So after you receive your vaccination, it's 2 weeks or 14 days before that really kicks into that 90% effectiveness with that first vaccination. So, and it's the same as if you receive your flu vaccinations. It always takes about 2 weeks after any vaccination that you receive for your body to take that information, do something with it, and then mount an immune response. So you are still at higher risk in that 2 week period of time after you receive your first vaccination that you could catch COVID more so than when 2 weeks out. So definitely, even after, just to be smart, always, use your mask, use your hand sanitizer, until we're ordered as a country that we don't have to do it anymore.
Great. Thank you, Vanessa. And just for myself and leadership and our frontline staff, just thank you all for tuning in tonight. Thank you, Kalsilum, for working your magic, typing the questions out for us, and Vanessa for answering all of those questions. And all of you, encourage each and every one of you to register your households. As Kalsilum mentioned, it's a community as a whole approach. We want to protect our community. And so everybody, make sure that you register for the upcoming clinics. Myself as well, I'm registered to get my vaccination on the 29th. On Monday, registered very quickly as well to ensure that everyone in my household and community is protected, and encourage each of you to do that, along with continuing to adhere to the public health rules and regulations around social distancing, maintaining your bubble within your household. If you're gathering with 10 people, make sure you're social distancing, and it's outside, it's not inside. And that we're all doing our part, because we've all done a great job thus far. And we've got to continue to kind of just dig down deep and continue to push, and we'll get through this together. Thank you.